MVP Kids Care has been around for decades in the West Valley, the Southwest Valley, serving the children of this community. And I am now old enough that I have patients who I also saw their parents. And that's one of the reasons I became a pediatrician. So I've been with the group almost 30 years now.
I joined MVP Kids Care in 1996 after training in Phoenix, Arizona at Phoenix Children's Hospital.
I chose to become a pediatrician. I knew I always wanted to serve when I was younger. I love children, and pediatrician was just the end point, so here I am.
When I got on the children's wards, I found that these children that were on death's doorstep one day, and they'd be in the hospital for 3 or 4 days, and then all of a sudden they're jumping on their beds, and then they'd get better and go home, and it was just a different kind of a feeling that the kids got better, and it seemed like what we did mattered.
Initial interest in pediatrics came after I graduated college and I started working in a lab. I was working as a lab technician at St. Jude Children's Research Hospital. Really felt a draw towards pediatrics starting then.
Well, my first rotation was at MVP Kids Care when I was a student, and I loved it so much I came back for my elective. And then after working for a couple years, I said I really want to be in pediatrics, and when an opening came at MVP Kids Care, I went back to work there, and I've been there since.
I worked for 3 years at a Ronald McDonald House in Greenville, North Carolina, taking care of kids with cancer and their families, and that's when I really became interested in pediatrics.
I decided to work in pediatrics because absolutely I love kids. I think that's the #1 reason anyone might decide to work in pediatrics, but I just find them to be super fun and they teach me different new things every day.
So I became very interested in pediatrics during medical school. When doing the different subspecialty rotations, I just fell in love with the pediatric aspect of being able to see babies, little infants, up through till teenagers who can speak for themselves, and it's pretty much like adult medicine. So you get the whole spectrum.
I love kids, and I love the idea of seeing someone start from birth and go all the way up through early adulthood. And I just love being around kids, their innocence.
I joined MVP Kids Care because during medical school I had a partnership with an entity that afterwards required me to work in an underserved area, and MVP Kids Care fell into that area, and so I called and spoke with one of my now partners who offered me a position, and I've been there ever since.
When I joined MVP Kids Care almost 20 years ago, the first thing I noticed was it was like a family.
The first day I was in the office, I fell in love with the place.
I think we have a wonderful team of doctors and nurses. We're also really flexible in terms of hours for families, and just a fun place to be and have your kids grow up.
People have been there for a really long time, and so they're invested, and I love going to work every day and hanging out and laughing with my friends and coworkers.
It is a fantastic practice. Every single physician in the office is incredible, caring, and super insightful.
We treat illnesses, we see kids for well visits, we see babies in the hospital.
We also offer comprehensive asthma management with asthma action plans, pulmonary function testing, spirometry.
We have a breastfeeding consultant, our own Dr. Holmgren, that can help our breastfeeding moms.
We give advice to parents on all types of behavioral issues.
We also offer excellent hours in our office from 7 o'clock to 7 p.m. most days, open on the weekends, and we also offer an urgent care style appointment basis.
A family should choose MVP Kids Care because we're invested in kids' lives, and we're a team. We work together, and we all just are passionate about health, and we want to treat other kids as we would want our own children treated.
Families should choose MVP Kids Care because we enjoy taking care of kids. We're a family ourselves, and I think that translates in how we interact with our families and our patients. We truly enjoy taking care of kids and having a good time.
What we're hoping to offer our patient group is a place that they can come for comprehensive care.
I believe MVP Kids Care is a great choice for families, mainly because of the care and dedication of the physicians and staff here. It's a very caring environment. Everybody really keeps up to date with the most current pediatric guidelines, and there is a lot of interaction amongst the staff, making sure that we're providing the most quality care.
This is the finest group of healthcare professionals that is in this valley. I really consider myself lucky to be a part of MVP Kids Care.